Hey, you know that annoying pressure band-like sensation that you get around your head or on the back of your skull right about 2 p.m. in the workday? It's probably a tension headache. Let's talk about it. Hi, I'm Dr. Zach Ratliff at TruMotion Therapy here in Charlotte, North Carolina, where we specialize in the conservative management of musculoskeletal pain and injuries. And one of those things is headaches, tension headaches in particular. One of the first things I always like to explain in regards to tension headaches is where's the pain coming from? And this is something called referred pain. It just means pain that is felt away from the source. Now, oftentimes with tension headaches, the source is the joints of the neck or the cervical spine or the muscles surrounding that neck as trigger points or muscle knots. They will manifest that pain sensation either almost around the ears, kind of in that ram horn pattern, or almost feeling like a band that goes around the head, sometimes even felt right on the back of the head, right at the base of the skull. Now, the factors that contribute to how we create this referred pain is multifactorial. It comes from a lot of different sources. Now, a lot of it can boil down to things like stress, anxiety, postural stresses, so the positions that we're in all day long, as well as things like our hydration levels and even our vision. So let's break all that down. Think about our postural positions. When we're sitting for long periods of time, most of us are sitting in a desk setting, in a corporate setting, we're gonna slowly over time drift toward our computer screen. Our chin's gonna start to jut. Or for most of us. Now, what that's gonna create is a little bit of a hinge higher up in the neck. It's gonna put a little bit more strain on these muscles, trying to hold that head up like a crane. Now, as that happens day in, day out, that tension slowly builds up. Let's add in the mental side of that. We have stress and anxiety about our job, about our life, anything else going on. All of these things are gonna make our shoulders clench up toward our ears. And we're just gonna hold that tension, almost like 10 to 15% of it all day long. We just can't let go of it. That's gonna create those trigger points in the muscle, and that's what can create those headache sensations. Now, other factors, like we talked about hydration. If we don't have enough water in our body, it's gonna make it harder for our muscles to work efficiently. Vision. If we can't see things well, we're gonna squint with our eyes, and that's either gonna make us move closer to our screen, or it's gonna make us clench at our neck as we move closer to that screen. So, as we talked about, there's a lot of different things that can go along with the tension headaches. It can also be accompanied by neck pain or even jaw pain, like TMJ issues. So there's a lot going on here, but the good news is that there are a lot of great treatment options. So from the conservative side of things, one of the biggest things we want to work on is our mid-back mobility. If our mid-back can stand taller, our head is inherently going to get pulled back, and it's going to allow those muscles in the neck to stay in a little bit more balance. Now, the other part of this is going to be retraining some of these postural muscles. So we're going to need some rehab exercises and movement in order to strengthen the muscles on the front of our neck to be able to hold our chin back, as well as the muscles in our upper back to hold our shoulders and mid-back nice and tall. Now, these are all going to be things that are slow over time, habit changes, but there are some things that we can even do in an office setting that can help facilitate that or get those wheels moving a little bit sooner. This is something that we often use dry needling for, so for those trigger points or for the pain in those joints, dry needling is a great option to help open up those muscles and desensitize some pain. And then we also like to use other hands-on muscle techniques as well as adjustments. These are all going to be things that can be a part of a treatment plan that help you get away from these headaches, decrease the frequency of them, and hopefully change some of your habits throughout your workday. So if this sounds like something you've been struggling with, I would invite you to check out our website at TruMotionTherapy.com, where we have more information, more videos, as well as the ability to schedule an appointment with one of our providers. And we would love to take a thorough look at what's going on and make a great plan for you, get you out of pain, get you back doing the things that you love.